That's going to be our lecture for today. I mentioned your exemplars. Let's pause for a minute. So I mentioned your exemplars earlier. They're also outlined on your student concept guide. We're going to be looking at the anxiety disorders as well as the personality and the eating disorders, okay? That's the information you guys will get from me. When we look at personality disorders, you have a wonderful little exemplar that puts them kind of in categories, which is cluster A, cluster B, and cluster C. How many of you have heard of those clusters before? Nobody? Okay. So maybe as we start the content, I'm sure you all, students typically say, okay, I know somebody with that. That sounds familiar. You start scratching your hand. Y'all can identify some personalities. So how does stress and anxiety begin? Who can tell me? How do y'all think it begins? What does it begin with? What do you notice about it? I hear stress. Okay. Coming this way just gets stressful for you. It starts when you get in your car coming to school on Thursday. Anybody else? Break out in highs when we make it to the parking lot. Heart start racing. Anybody else? Upset stomach. So y'all are having thoughts that create feelings. Are you not? And sometimes those feelings, what do they create? Behaviors. And those behaviors can interfere with us if we are not managing them correctly. So this should be coming on in just a minute, okay? So it goes with the PowerPoint that's on Teams. So behaviors often do what to thoughts? Reinforce them. And then that leads to what? Excess stress and anxiety. And what do we need to help us get through the day with all of this stress and anxiety? I hear appropriate coping mechanism. Thank you. What are some of those that you would recommend as a nurse? I hear deep breathing, music, guided imagery, Gregory, medication. I like medication. Exercise. And my favorite is med and therapy go together. Medication and therapy go together. It's a hand and glove effect. You can't have one without the other. You need them both. I like exercise too because there's a lot of benefits to us exercising when it comes to stress and anxiety. We know that this stress and anxiety, from reading your concept overview last week, it could lead to what other kind of problems or conditions? Medical problems and conditions that could interfere with your heart. Remember all of those systems we went over? We went over the endocrine system. We talked about how all the body's systems could be affected if this stress and anxiety is not managed effectively, right? So what are you guys doing to manage your stress and anxiety that you would recommend to someone else? You started walking? Again. Started walking again. Anybody else? Started therapy. I love therapy because it's confidential. You can just let it all out. You can relax on that couch and just vent and talk. I love therapy. What else? What else are y'all doing? Music. What, Gregory? It's inappropriate, but don't share it. Any appropriate coping mechanisms we're doing? Anybody? Appropriate. Yeah, appropriate. Tell me something. Anybody?
Like your hobby, whatever you like to do.
Your hobby. Okay.
Me time.
I like that. What are some me time exemplars? What are y'all doing? Anybody getting a massage? Anybody taking the dog for a walk? Maybe. It's cooler, so you can't say it's too hot outside. Got a rabbit? Are you petting a rabbit? Pet therapy. Okay. Need a rabbit. What are you guys doing? I don't believe it. Sleep. We need adequate sleep, but too much sleep is not good. Okay, we're getting proper rest. At least how many hours do we need? 8 to 10, at least. Going to bed on time. Shutting it all down. Remember we talked about that in second semester? Sleep therapy, sleep aid enhancements, not bringing anything extra into the bedroom, turning everything off with the blue screen. Remember, getting in bed, winding down. Okay, what else are we doing? Anybody? That side of the room, what are you guys doing? Drive home real slow. I like that one. Winding down before you get home. Just gonna cruise on in. Sit in the car and get your thoughts together in silence before you get in the house. You get on TikTok and laugh a little bit. Okay. Anybody? Cry a little bit. Do what now? Oh, okay. A lot. Or a lot. Cry a little bit or a lot. Okay. Just beat it out. Cry. Okay, middle section here, Hannah. What are you guys doing? You like to cook? Because you like to eat. All right. Anybody else? Music. Huh? Just blast the music. Oh, wow. Okay. Dance. We're dancing. What about in this section? What are you guys doing? Anybody? Watch TV. Okay. Relaxing. Put your feet up and watching your favorite show. I can remember, what was Power? Power was like my go-to. Yeah, let me just get home, get my PJs on, prop my feet up, don't mess with me. I want to see Power. Okay? What about this section? What are you guys doing to help with stress and anxiety? Eating, stress eating. That could be a bad. But what are you eating? It could be healthy, huh? She's not eating carrots. Okay, well, that's for the rabbit. Eating? Anybody? Do what now? Grey's Anatomy. Okay. Well, I'm going to share with y'all what I'm doing. I said it last week. What was it? I get up every morning and go for a walk, an hour and a half. I'm already at like 14,000 steps. I do 10,000 in the morning. That's my time. So it's really good, exercise can help maintain your glucose level. It can, as soon as daylight breaks, usually it's 6:45, I have one of these, working vests that the people on the railroad have, a neon with the stripes. Yeah, I don't want to get hit early in the morning, but I live on a rural road, so it's not a lot of traffic. But I will come out with a light, yeah. Hey, I'm familiar with the area, so I go for a walk. So just something you guys can try to do to help. It's a balancing act. Y'all got to balance it out, okay? So thank you for sharing what you're doing, and if you're not doing anything, guess what? You need to start, Gregory. You need to start. Give up 30 minutes of social media, Facebook. People tell me, oh, you didn't see such and such, such, such. Who has time? I'm not in the loop, so somebody always has to tell me about it. So give up something and try to start working on your stress and anxiety and some positive, some good coping skills. It's only 30 minutes a day. So let's talk about stress. How do we get stress? Where does stress come from? Can it be environmental? What else can be a contributing factor to stress? Your husband, physical condition, your overall health. Could it be stressful if you're on dialysis and now you find out you got to get an amputation? Yes. Yeah. That's stressful. What else could lead to stress? School, finances. Are the level of that stress perceived? But you guys just spoke with somebody that could possibly help with that financial burden. So let me tell you, I've known people from every area, and they usually do better outside of this area, getting that money to pay for like everything. So don't count yourself out until you go apply, okay? Anxiety. We learned last week that anxiety can be what? Acute or what? Chronic. And let's talk about the relief behavior. We need some what? Defense mechanisms. Who can remember what some of those defense mechanisms were? You kind of learned about them in second. I think we had a handout posted in modules. There was several of them. Do y'all remember any of them? One handout. Anybody? Say it. Say it loud. You had to hand that out, but you saw it, right? What do little kids do if you got a toddler and then mama has a new baby and bring that new baby home? What does that toddler tend to do? Regret. Right? If they've been potty trained, they do what? They might start back what? Wet in the bed again. What are some of the things that adults do? Anybody? Cry? But those is some terms. Jominique, you found your list? Call some of them out, Jominique. Repression. Denial. Do we deny the fact that it's actually happening? No, this can't be true. Not me. You got to be kidding me. No, I'm not accepting that. Okay, what else? Rationalize. Do we often rationalize internally about the issue? Yes. What are some more, Jominique? Just name 3 or 4 more. Displacement. Do we take what we're going through and displace it on others? How many of us are guilty of that? Had a bad day at home, you go to work and everybody who walks in front of you is confronted. They're reaping your problem. You're like, I'm just an innocent bystander. I said good morning. You know, do we displace it on others? What else, Jominique? Projection. Sometimes we project it on others as well. What's the definition for projection on there? Do you see it, Jominique? Is it on that handout? You're attributing your impulses to someone else. Your thoughts, feelings, and motives on to someone else. Projection. So be sure that you guys go back and look at that handout. It lists all of those defense mechanisms. And oftentimes where we see these defense mechanisms used the most is in mental health, okay? Thank you. Also on page 810 in fundamentals. So let's talk about effective ways to deal with it. If we deal with it effectively, what's going to happen to our anxiety? It's going to decrease. That's the goal. We want to make it through the day, right? Be able to cope and make it through the day. But if it's ineffective, what are some things that could happen? Increased anxiety? Are we going to be able to cope? Are you going to be able to function or concentrate? Are you going to remember everything on your list of things to do? Could you forget to pick the kids up from daycare? Yes. And I'm not going to say it in this way like this might be what happened, but I often think about those parents who leave the child in the car in the summer. Got 1,001 things going on. You know, I wonder about the mental health aspect of that. Extreme use of defense and coping behaviors or exacerbation. If it's so worse, could you start hearing things? Could you start hallucinating? Could you become suicidal if you're depressed? Yes, you could. So chronic anxiety, if anxiety is not unrelieved, if you don't deal with it, it could lead to a chronic problem. How many of you know somebody who says, I can't go to a basketball game? Too many people, too much going on for me. I need to stay in my little corner. I know someone who's been institutionalized for 27 years. And guess what? When they got out, they still go in their room and barricaded it, like locks on the doors, lock the door, push something up to the door, won't even sleep in the bed, sleeping over in a small corner. What happens in military oftentimes when these guys go off to war and come home, what do they have to go through? What's that process called? Yeah, but they go through what before they're released back home with their families? Like a debriefing to learn how to cope and be more hands-on and be affectionate with their children or their kids, right? So we need to recognize that stress and anxiety is real. If it's not managed effectively, it can lead to problems, and we know that these problems could affect our body as a what? Whole. Very good. So, define levels of anxiety. We covered all of these last week. So this shouldn't be hard for you if you had mild anxiety. Who had mild anxiety last week? Make me go to my list. What is mild anxiety? It's useful for everyday problem solving. You can solve problems with a little bit of mild anxiety, right? Some of you had a little mild anxiety this morning when you woke up, right? Oh, we got to take that test. Then we got class. Oh, my God. Now I got to find a magazine. She really want me to buy a magazine. I can't believe, working yourself up before you even get here. Let's talk about moderate. Selective inattention. Ability to think clearly is hampered, but you can still problem solve. You might get a headache. Some of y'all told me you had an upset stomach. Increased heart rate. I think Jada said just chest palpitation. Or increased breathing. You done work yourself up into a little pain. Now my stomach is hurting on me. Oh my goodness. Now I got to try to go in here and take this test. I better not eat anything spicy. You're going a little bit too far with it, right? What about severe? Can only focus on one detail, or details may be scattered. Have you ever asked somebody about something that you're supposed to do and they're like, they can only tell you one thing about it, or they can't even tell you nothing about it? Some of y'all are looking like, that was me last week. Anybody experienced that? Like, what? She didn't say that. I didn't hear that. Most of the time. Okay, thanks for being honest. And with severe, we may see a headache, nausea, dizziness, and it can impact our ability to sleep. Now, who's having sleeping problems in here? You done bought the new mattress, still having sleeping problems in here. Working night shift, only because, it can be contributed. You're back and forth on your different shifts. Did you all know that this stress and anxiety can interfere with your ability to sleep? I got to have my sleep. I will be ill as a little what? Hornet if I don't get my sleep. So you got to deal with it. Deal with your stress and anxiety. Did you know when your mood is good, your sleep is good? Think about it. When you're unmoody, you're not able to sleep at night, even with the new mattress, okay? So, let's talk about panic. What is panic? It's to an extreme, okay? You're unable to process the surroundings. You may be pacing, you may be running, you might even be screaming, having hallucinations. And if panic is not treated, what can it lead to? Exhaustion. You're going to burn out. How long can you keep going like this? Right? You cannot do it. I know it's a lot of super women in here and super men, but you're going to eventually do what? Fizz out. And I always tell students, if you're putting out everybody else's fires, you know, some of us got to be all up in it. We're the go-to. We got to deal with everything. Who's going to help you put out your fire? You got to be a little more what? Selective. I'm not going to use all my water up putting out your fire. Who's going to put me out? Nope. It's okay to say no. Let's practice it. No.
No.
Come on. No.
Heck no.
No.
I ain't doing that.
Now don't get put in the doghouse, Tony. Don't get put in the doghouse now.
No, heck no.
You need to know your limitations.
Oh, okay.
So practice saying no, because sometimes we try to juggle more than we can actually take on. Anybody guilty of that? And then you got to do the extra stuff like Sunday school, class, Bible class, youth class. Then you got to do the kids stuff like volleyball, basketball, swim, gym, track, dance, cheer. And then when is there any time for you? And then you sleepy. You can't keep your head up. You bobbing. You bobbing. So it's okay to say no, because panic will lead to exhaustion. And if you're exhausted and burnt out, how effective are you going to be? Let's say you work the night shift. You got off at 7 this morning. Well, you came home and you had the Sears guy coming, like one that's going to come to my house. And they give you a window between 8 and 5. So you're like, well, okay, I'm going to sweep a little bit. While you're up sweeping, you decide, I'm going to go ahead and mop. I need to do this laundry. And then somebody calls you and says, the kids need to be picked up at school. One of them is sick. I think he got a stomach bug. So you run to the school to get the kid. Then you come back and somebody down the road who knows you're a nursing student, can you come down here and check such and such blood pressure? I think his blood pressure is low. Then you get back home and you thought you had your meal planned out and you're like, dog it, I don't have any bread. And we were going to do hot dogs tonight. So now you got to go to the dollar store. It's the closest thing. And then they call you and said, we're going to need you to come in because you was on call tonight. And you're looking like, what? And it's time to go back in. Well, you go to the store and buy you, what is this everybody buys? A Monster or, I don't know. What is everybody buying? Energy drinks? I can pull it off. I'm going to buy me an energy drink. Well, you get the energy drink and it's working, but between the hours of 3 and 5, it's like shutdown time. And you got some critical patients you're taking care of. How you going to push it through the night? What you going to do? So I got to take a nap on my 30-minute lunch break. Okay, you get a 30-minute nap. Drink another energy drink is probably what most of you are going to do and try to push it through. Well, then you get home the next morning and it's time to go to sleep, and guess what? You can't go to sleep. You got all of this caffeine overload. You have drunk a Red Bull and went home and went to sleep. You'll fall asleep anywhere.
You give me enough time, I'll do it right now.
So I'm not going to give you any time. So what I'm saying is you guys got to take time for yourself. You got to manage your stress and anxiety. And sometimes it's okay just to say no. Even to the extra shift or the double pay or the whatever. They've pulled away a lot of the incentives now. You know, even when it comes to nursing school and preparing for your test and your exam. Yeah. Tell me no. And I'm going to say, that's on you, Ashley.
I ain't doing that ticket to class tomorrow. Ain't
That's on you. That's on you, Tony. That's on you. I like it. It's okay to say no, all right? If y'all don't get anything else, and sometimes we struggle with saying the word no. So we got a small case study here. I need one reader. Can I get a volunteer? No. I like that. See, y'all are getting good practice. And today you're going to get a pass. You get to tell me no, but then I reinforce it. So you're getting some good practice. So when you get home, you know, you can try it out and see if it's effective when you get home, okay? Who's going to be my reader today? Anybody? Thank you. So how you think SW is feeling right about now? Got a 2-year-old son. She lives with her husband. She's been at this job for 3 years. And she was just diagnosed with non-Hodgkin's lymphoma. And she got to begin chemotherapy immediately, having several rounds and several treatments. What do you think SW is going through right now? Anxiety. Thank God they caught it. Yeah, I like that answer too. Could it be worries about finance? She just started a job. Who's going to take care of the baby? I'm not going to be able to cook after I come home from chemo and radiation. Who's going to keep the house up? Hopefully she got an understanding helpmate. Okay. He's understanding, but he can't cook. So what you going to do now? Her mama's going to move in to help her out. That ain't going to happen. Mama's going to cook some meals and drop them off, but she ain't moving in. You got a buddy who recently did that, Jimmy? Didn't work out.
I wasn't going to say who it was.
What did Jimmy say?
I was fixing to say it ain't me, and then I thought it was too ugly.
Ain't nobody even there.
Let's read the second part of it. Anybody? What's the most concerning information presented just then? Pressure in her chest, palpitations, difficulty breathing, which y'all agree? So how do you think she's feeling now? Anxious? Anxiety? She's in panic mode? I'm hearing panic mode. Who's going to take that one for me?
The symptoms SW has been experiencing has started to interfere with her work and her life. Her husband tells her, just calm down. I do not know why you get yourself worked up. All worked up over nothing. She calls for an appointment with her healthcare provider. At the appointment, the nursing assessment reveals the following vital signs.
So what are the vital signs? Heart rate 139. 184 over 104 BP. 9702 set. 25 for respirations. Anything wrong with those vital signs? Blood pressure, heart rate, and respirations. So what medications would you anticipate the provider is going to order? I hear anti-anxiety. Anybody else? Blood pressure medicines. Dilaws, the beta blockers. In your F.A. Davis book, and I want to give y'all some pages, so write this information down. On page 570 through 572 and page 595 is where you're going to find your SSRIs, okay?
What's that second one?
570 through 72 and 595 are your SSRIs. On page F.A. Davis, your antihypertensive meds that can be used are on page 571 and 572. F.A. Davis. Drug interactions can be found on page 63 in your F.A. Davis book. drug interactions. We're going to stop right here and take a 10-minute break, okay? Anybody want to take a stab at that little next section for me?
The HCP orders propranolol 40 milligrams PO BID and buspirone 5 milligrams PO every 8 hours is needed for anxiety. The HCP also orders a consult for psychiatric treatment and reschedules her PET scan for the next week. What is propranolol and how will be monitored for effectiveness?
Let's start with that one. What is propranolol? Anybody? How would you monitor to tell if it's effective? Check the heart rate, the blood pressure. Ask the patient about their anxiety. Very good. What about buspirone or Buspar? How would you monitor for effectiveness of it? Ask them about their anxiety. Why do you think that the healthcare provider rescheduled the PET scan? Can you imagine laying on a narrow bed, going through a small tunnel? This scanner is going to detect any disease cells or images, and you have anxiety laying there for about 20 minutes. Is she going to be able to tolerate that PET scan? She wouldn't be able to tolerate what other procedure as well or diagnostic test? MRI, because they're laying in a small tunnel. So we want to get the anxiety managed first, okay? We often see propranolol used a lot with stage performance or stage anxiety. Let's say someone is going to be speaking or speaking before a large crowd. You may see propranolol being prescribed for that individual. Buspar is an anti-anxiety med. And again, we're going to monitor for anxiety. So what are some of those symptoms of anxiety, or what are those triggers? What symptoms might the individual experience? We talked about mild, moderate, and severe anxiety, and y'all told me some things. What were those symptoms? Increased heart rate, stomach, discomfort, tremors, headache, palpitations, nausea, vomiting, headache, any of those symptoms. Would it be good to maybe identify the triggers? What triggers your anxiety? Somebody said on Thursday, get in that car, come in here. Pulling up out there in the parking lot. It just hits me all of a sudden. Right? What are some rating scales that's oftentimes used for rating anxiety? The 0 to 10 scale, but there are some specific just for anxiety. Anybody know? We mentioned one last week. Starts with the H. Hamilton Anxiety Rating Scale. If that's not loaded in Canvas, I will load it in Teams. I'll load it for you all, okay? All right. Any questions on our little SW client before we move on? Let's talk about fear and phobias. Create a case study with the client who has obsessive compulsive disorder. You're going to include background information, the symptoms, including when they started, healthcare provider, and nursing interventions. Do not confuse obsessive compulsive disorder with obsessive compulsive personality. So who can tell me what obsessive compulsive disorder is? See F.A. Davis, page 556 and 557. Y'all take a moment. We're going to pause the recording. Go through your magazine. See if you can pull out any picture or tag a picture with OCD. Give us a little background information about the symptoms and what would the provider order. Individual recognizes that the behavior is excessive or unreasonable, but because of the feeling of relief from discomfort that promotes, is compelled to continue the act. Something about completing the act is a sense of relief. If you interrupt the cycle, it's anxiety, it's tension, might be a little argument or a little feud, but it's something about completing the act. This disorder is commonly equal among men and women. It may begin in childhood, but more often begins in adolescence and early adulthood. The course is usually chronic and may be complicated by depression or substance abuse. Obsessive compulsive disorder is identified more frequently in single people than in married, but this finding probably reflects the difficulty that the individual with this disorder have in maintaining interpersonal relationships. So, obsessions is the intrusive thoughts that are reoccurring and stressful. Obsession is just a reoccurring thought, the thought about doing it. Although they are recognized by the individual as irrational, they continue to be repetitive and cannot be ignored. You cannot ignore somebody who's doing this 15 times. Every time we get ready to leave, you got to touch it up 15 times. It should not be ignored on 556 in your book. The compulsion. The compulsion is the act. The act. Repetitive ritual behaviors are the mental acts that the individual feels driven to perform that are intended to reduce the anxiety with the obsessive thoughts. So again, obsessions are the thinking and the thought, but the compulsion is the what? The act of the doing. The doing. How do you treat it? We typically allow the individual to continue with the behavior, but what do? We shorten the time frame. Today you're going to get 20 minutes. Tomorrow it might be 15. I'm going to encourage all of you guys. You have a care plan in your book for all of these disorders. You need to look at the care plan and be familiar with them, okay? And that care plan, the diagnostic criteria, how do you get the diagnosis, can be found on page 557. 557 is the diagnosis. The Hamilton Anxiety Scale. I mentioned that to you all earlier. It's on page 561 in your book, okay? Assigning nursing diagnosis for OCD. The nursing diagnosis for OCD, 561. And the care plan for OCD is 562 and 563. Care plans for patients with anxiety, obsessive compulsive, and related disorders. Read the care plan. Read the little orange dots in your book. It's going to be very helpful information. You need to read that. This is the test you got to get in your book for, okay? It's going to seem very common sense, in which it is, but you need to know what to do. We're going to take a brief stop on the video, and y'all are going to... Body dysmorphic disorder. This can be found in your book on 556. What is the definition? Can anybody tell me? Gregory's definition was a man that hates his body. Okay, anybody else? I got 556, yeah. Erica? If it's a true defect is present, the person's concern is unrealistically exaggerated or grossly excessive. Symptoms of depression and obsessive compulsive disorder are common. Let's think of some famous people we know that had that body dysmorphic disorder. I'm looking for one name. I heard Tammy. I hear the answer I want was right here. Michael Jackson. Michael Jackson. What did he do? His skin, his face, his nose, a lot of nose jobs. And who else? Y'all name some more. Kate Moss. What did Kate Moss do? I'm not up on my actors. Y'all listen up. She was what? Extremely skinny. So we're going to put her also in the eating disorder group when we get to her. She did what? Lots of cocaine. Oh, substance abuse too. What about body dysmorphic? You know, it's this person who wants their nose done. Oh, something wrong with my nose. My lips. Who's getting the lip injections? And my lips need to be a little more puffed. I'm serious. She died. She was a television celebrity. Is it Joan Rivers? Joan Rivers had a lot of surgery, right? Unrecognizable to the point of not being able to recognize who she was. Okay? So, body dysmorphic disorder. You want to encourage the client to express their feelings. Anxiety meds are often used for them. Mindfulness, and they need a realistic perception of their body image. This one can also accompany an eating disorder. What eating disorder is that? Anorexia, because the individual will always feel or view themselves as what? Fat or big. Very good. Reader.
JW is a 40-year-old male. He lives at home with his wife of 15 years and 3 children. 2 months ago, he returned from his third deployment in Afghanistan. His wife voices concerns that he has been drinking whiskey every day and gets very angry with her and the children very easily. He relives episodes of his deployment and gets very upset when talking about certain events. Last week, his boss placed him on temporary leave of absence because he was unable to carry out his daily routine without angry outbursts. During a recent site visit, he was diagnosed with PTSD.
PTSD. Y'all know a JW? Anybody? What are some of the symptoms or the reasons the client developed the PTSD? Who can tell me? F.A. Davis, your PTSD information is on 580 and 581. It can also be found on a little information on 844. So let's go to 580 and 581. Who can tell me what are some reasons this client developed PTSD? Why do y'all think JW developed PTSD? Traumatic event. He was over where, Tony?
Afghanistan.
He was over in Afghanistan. Okay. What else did y'all say? A sustained high level of anxiety. Do you believe he was under some pretty intense stress or anxiety the whole time he was deployed over in Afghanistan? Being on alert, taking different shifts, watching out for his peers, protecting himself, right? Fighting or serving for his country. So, you got some symptoms on page 580 or 79 in your book. It goes over the definition of PTSD. 580 and 581 gives you the diagnostic criteria. So, what is it described as? Who want to tell me? A multi-symptom response triggered by extreme traumatic events. These symptoms are not related to common experiences such as uncomplicated bereavement, marital conflict, and chronic illnesses, but they are associated with markedly distressing events that can be that way for anyone. What are the characteristic symptoms? What do they include? What are the symptoms? Re-experiencing the traumatic event. Sustained high level of anxiety or arousal. General numbness of responsiveness. So what is the goal? The goal is going to be that they can acknowledge the traumatic event and the impact that it's had on their life. You want to know if the individual is experiencing what? Fewer flashbacks. If they put on some medicine, how do you know that the medication has been effective? What should we see? Fewer symptoms, fewer flashbacks, fewer nightmares or no nightmares. They can demonstrate adaptive coping strategies. We want them to demonstrate adaptive coping strategies. Instead of taking that anger or fussing at the wife and kids, he may do what now? May go outside and go for a walk, right? Can concentrate and has made realistic goals for the future. This PTSD should not interfere with his day-to-day activities, and hopefully this individual can make realistic goals for the future. Now that I'm back, I'm going to help the kids be more attentive and get them to all of their practices. Now I'm going to be more hands-on, and I'm going to get little Johnny into baseball and practice with him every afternoon. Should be able to set realistic goals. Include the significant others in the recovery process and willingly accept their support. So who are we going to bring on board while they're going through? While they're going through treatment? The significant other, whoever that is. Verbalize no ideas or thoughts of self-harm. Do we want them wanting to harm themselves? No. Safety is always going to trump everything else in mental health, okay? We want them that they should be reporting that they're sleeping what? Better, more, throughout the night. Sleeping for longer periods of time. They're getting rest. They feel rested. They should work through their feelings of survivor guilt. If they watch somebody get got blown up, and they're feeling guilty because the friends died, but they made it, do we have to work through that process? Yes, we do. Verbalize community resources where they can seek assistance to help with stress. What's available in your area for stress or coping? What's available here for you all that's a free service? Therapy sessions. Y'all should have been told when you entered this program about a contract that we have with Wings, where you can go and get 3 free sessions at no charge for being a student. Well, now you know. You get 3 free services. And that's also in your first day handout. Go back and look at the counseling that's available to you. Yeah, 3 free services. Attend support groups. If they're going through therapy, is it important that they be amongst people who are going through the same thing like they are? And you're going to see that being mentioned again when we go over the substance abuse information, okay? Verbalize the desire to put the trauma in the past and do what? Move forward. You got to put all of that stuff that happened in Afghanistan where? Behind you. And you got to drive looking what? Forward, straight ahead. Can you drive looking in the rearview mirror? You're going to do what? Hit somebody, right? And if you're looking in the rearview mirror, you're still focusing on what? What's behind you? What's in the past? So those are some realistic goals. What type of treatment might be ordered for this client? What do y'all think? What you think he's going to get? Therapy and some medication? And if he's lucky, what else might he be able to get through the VA? A pet dog? What else? This one I think is an all-time favorite. Everybody wants this one. The disability. The money. There's funds out there. If this individual has experienced something, they get a paycheck. They get a percentage for being disabled. So again, your information is there in your book on 580. Diagnostic criteria is on 581. And the recovery environment is mentioned on 582. So this is the brain of an individual that has PTSD. What's different about this picture compared to this one? It's more active. So what can stress, anxiety do to your brain? It's going to interfere with your coping, your cognition, your concentration. You're going to be cloudy. So go back to those systems. Remember when we talked about stress and anxiety and panic on the body as a whole? Can it have effects on your brain? Yes, it can. This was my favorite. This is an oldie. This is your brain. And this is your brain on what? Drugs. Do y'all remember that commercial? Who has not heard of that commercial? Pretty funny now. Yeah, so you got to take care of yourself. This is y'all's brain. You want a healthy little sponge, right? And how can we keep that sponge healthy where it can absorb all of this information? And when you squeeze it, it can put out all the information. What do y'all need to do? What changes do you need to make? I want a healthy sponge, right? career, the profession. You got to do a lot of critical thinking. You got to keep your stress and anxiety to a minimum. So it's some things we can do as individuals. Now we're going to talk about the 3 personality disorders. If you notice on this handout, personality disorders have been put into clusters. And we're going to kind of talk about them in clusters. Who can tell me what is cluster A? Odd, say it loud. Odd eccentric clusters. And what all does it include? Paranoid, schizoid, schizotypical. Very good. What about cluster B? Dramatic and what? Unpredictable. If they're dramatic, that means they like a lot of what? Attention. Who are those individuals? Which personalities do they have? Antisocial, borderline, histrionic, narcissistic. Do y'all know anybody that falls in those categories? Usually this is the one where I get a lot of feedback from students. Y'all start thinking about things and people and places you go and what you've seen. What about cluster C? What is in this category? Who are these individuals? Anxious, fearful. And who might they include? Avoidant, dependent, obsessive compulsive personality. Very good. So the way we're going to talk about them is kind of going to be in clusters as well as the interventions. Who can tell me what is personality? Give me a definition. Look up personality. What is personality? Personality. Index. Anybody got an index?
The totality of emotional and behavioral characteristics that are particular to a specific person and that remain somewhat stable and predictable over time.
Somewhat stable and predictable over time. What was that first part again, Ashley?
The totality of emotional and behavioral characteristics.
Emotional and behavioral. They're going to act a certain way, right? Their emotions are going to be a certain way. And it's going to be characteristic of that behavior. And you're going to be able to notice it over a certain amount of time. And more than likely, it's not going to change. They're going to display it often. Thank you, Ashley. Let's look at the paranoid personality disorder. And what cluster does paranoid fall under? A, and we said this individual is going to be what? Odd and eccentric. Very odd is what Gregory said. So what is this person going to do? What is the G for? How many of you know that person? What do they do with grudges? Still holding that kindergarten grudge, right? Still walking around with it. What else are they going to do? What is the E for? Exploitation, expected, without a sufficient basis. What about the T? Of others is doubted. Are they going to trust you? Probably what? Not. What about the F? Always accusing a sexual partner of what? Cheating. It's 5:02. Yesterday it was 5:03 when you made it here. Yeah. Why you haven't made it here? What you doing? They might even go to the period of putting a what on that person's car? Tracker. Better yet, putting it on their what? Phone. Forget the vehicle. Gonna put it on the phone now. So what is the A for? Attacks on character are perceived. Everything that said what? It offends them. It's an attack on their personal character. Can they shake it off? What about the C? So am I telling anybody about what's going on? No, because I don't do what? I don't trust anybody, right? Keeping it all to myself. I'm being suspicious. I'm watching. And what is the T for? They read into events. So is any and everything as bad as it always seems it is? So this person is going to see the glass is always what? Half empty instead of half full, right? Or full of poison instead of water, because I'm paranoid. This information can be found in your book on 657. So notice that your book is going to jump around a little bit, and as you're studying, you need to jump around and study, okay? Yep, jump around and study because you're going to find it in various chapters. So it tells that a nursing intervention for this one, should you be confrontational with this person? No. Because are they going to go for it? No. You need to talk to them in a non-challenging manner, right? They don't trust you. They're paranoid. They're very suspicious. They're not going to confide in you. So should you be getting into an argument with this individual? The clinical picture on 657 says that they're guarded, hypervigilant, and ready for any real or imagined threat. Do you know anybody? They're sitting on go. Try me. Try me if you want to. Stay ready. You ain't got to get ready. They avoid interactions with other people lest they're forced to relinquish some of their power. They always feel like others are planning to take advantage of them. Any perceived slight injuries or insults become long-held grudges. Yeah, she said that about me. Back in first grade, I remember what she said. Long-held grudges. We had the 40-year class reunion, and she's still talking about first grade. They are extremely oversensitive. You got to tell them it's a joke. You can't. Hey, this gonna be a joke now. Oversensitive and tend to misinterpret even that minute cue within the environment because this person trusts who? No one. They're constantly doing what? Testing the honesty of others. I'm gonna see if she's gonna tell me the truth. I'm going to tell her this and see if I'm going to hear it again. They do not accept responsibility for their behaviors. So can you confront them? No. They're going to project this responsibility on the others, and project is one of those defensive mechanisms we talked about earlier. They are envious toward others that are highly successful. And believe the only reason that they're not successful is because they've been treated unfair. Oh, Lord. So, you need to be familiar with your nursing interventions. You may have to take away privileges from this person in the hospital if they are threatening, right? They may have to stay on the unit. You may have to set limits and reinforce limits, right? When it's med time, you may have to open their medicines well. Right in front of them. Right? Sound like they're going to play on staff because they're trying to test the waters, right? So as you're studying these, you're going to bounce back in your book, find the information, read over the nursing interventions for each, okay? That's going to be the only way to get a good handle on it. What we're going to do is stop right here. We'll come back at 6 o'clock. Can I get a reader for the next scenario?
Because he was always in the boss's office talking and laughing. He was suspended for 3 days related to this conversation. Continue. He is being admitted for psych evaluation after his mother convinced him to seek treatment for his behavior. During his initial eval, he stated that his girlfriend was always cheating on him, and he knew because she always wore lipstick to work. He also stated that his coworker and boss were rallying together to help him fire, and that is the reason
What do we think his diagnosis is? Paranoid what? Personality disorder. Any questions about that one? Does he kind of fit the description of everything we just went over? Again, that information can be found in your book. So as you're studying and reviewing, be sure to take the information on the handout, go to your book, read it again, look at the interventions and the care plan for each. The interventions is what you're going to be doing as a nurse, what you would do for this individual, okay? So I really want to hone in on that. All right, let's talk about our next personality disorder. And what is this one? Schizoid. This can be found in your book, F.A. Davis book on 658 also. Schizoid personality, there's a mnemonic for it, and what is it? Sir Safe. Let's talk about the S. What is the first S? Solitary lifestyle. What does that mean? Like to be alone. I can roll on my own. Don't need any partners. I'm good. What is the I for? Indifferent to praise or criticism. Don't know how to take it. If you mean it, what you mean by that comment? Don't know what you're trying to say. Don't know how I'm going to feel about it. What about the R? I'm good. Don't need anybody. I got it. Thank you. What about the S? Sexual experience? Not interested. Pass. No, thank you. Okay, what about the A? No, that's okay. I probably wouldn't like it anyway. And the F? I'm good. I can do this all alone. I'm fine, thank you. And what is the E? Cold and detached. Let's look at that individual in 659. Schizotypical. It said they're the latent schizophrenics. They're odd and eccentric, but does not decompensate to the level of schizophrenia. So they kind of resemble schizophrenia. Remember when Dr. Norman talked about schizophrenia to you all? But they don't decompensate enough where they are placed in the hospital or admitted. Symptoms that are closer to those of schizophrenia than to those of the schizoid personality, such as show significant peculiarities in thinking, behavior, and appearance. When we look at the clinical picture, the schizotypical personality disorder, they are aloof and isolated and behave in a bland and apathetic manner. They have what's called magical thinking, ideals of reference, illusions, depersonalization as part of their everyday world. Examples include what? Superstitious, beliefs in clairvoyance, meaning they got some kind of what? Superpowers or special powers. Let's see what else. Am I on the wrong one? I'm sorry. No, you did it right. I was on schizotypical. Thank you. I appreciate it. Let me just jump back, scratch that. All of schizotypical. Let's go to schizoid. So on your video, make sure you're looking at schizoid and not schizotypical. Thank you. I appreciate it. 658. Schizoid. This individual is eccentric, isolated, or lonely. They have a lifelong pattern of what? Social withdrawal. It may go undiagnosed unless it's recognized when the individual seeks health care for other reasons. Many people with this disorder are never observed in a clinical setting. Let's look at the clinical picture. They are what? Cold, aloof, and indifferent to others. And that's kind of similar to the schizotypical. They have solitary activities or engaging more with who? We prefer pets rather than people. They prefer to work in isolation, and they are unsociable, with little need or desires for emotional time. Do they need anybody in their circle? They're fine what? All alone. They are able to invest in enormous effective energy in intellectual pursuits. In the presence of others, they appear to be what? shy, anxious, and uneasy. They are inappropriately serious about everything, and they have difficulty acting in a lighthearted manner. Can you joke with this person? Probably not. They exhibit little or no spontaneity. Can they be spontaneous with you? Typically, they're unable to experience any what? Pleasure. What have you done that's been fun? I'm going to scratch my head on that one. Predisposing factors. The childhood of these individuals have been characterized as bleak, cold, and lacking empathy and nurturing. A child brought up in this type of parenting may develop schizoid personality traits if the child possesses temperamental dispositions that is shy, anxious, and what? Introverted. All by themselves. I'm good. Leave me in my corner. That's okay. I don't want to play. I like being alone. So, schizoid personality disorder is safe. And again, it can be found in your book on 658. Any questions on the schizoid personality disorder? Schizoid. So as you're listening to the lecture, make sure you're looking at schizoid and not schizotypical or schizotypical like I did for clarity. And thank you, Heather, for pointing that out. Any questions on schizoid personality disorders? Can y'all recognize that person? I need a reader for our next scenario. Okay, who read last? Marilyn? Pick somebody. Oh, Marilyn.
I'll do it.
Go, Jada. And then you're going to pick somebody. Yeah.
JR is a 37-year-old male who works as a remote insurance salesman. He has been working from home for the last 8 years. He does not like to have in-person conversation and has not had a girlfriend in 2 years. He has no interest in becoming close with other individuals. He is very good at this job and has been promoted twice since becoming hired. He spends most of his time working and does not leave his home unless it is necessary. JR has just started seeing a therapist due to his increasing anxiety revolving around an upcoming business trip that is mandatory.
What's going on with JR? What is his most likely diagnosis? Schizoid. Does he fit the clinical picture? Yes, he does. Very good. We're going to change gears here a little bit. Who can tell me the name of this one? Schizotypical. And what's the acronym for schizotypical? UFO what? Aider? What is the U for? Unusual perceptions. Okay. The F? So who is their closest friends? Okay. What is the O for? Beliefs, thinking, and speech. Tell me about the A for aider. Affect is inappropriate and constricted. What about the I? And the D? And very what? Yes, what is the E? And so are they going to kind of stand out in the crowd? Probably so. Are we going to get them in a crowd? What is the R for? Reluctant. We probably won't be able to get them in a crowd. So now we're going to jump to 659 in your book. And schizotypical. We're going to try it again. This is your latent what? Schizophrenias, where I was on earlier. Remember, we said they were odd and eccentric, but does not decompensate to the level of what? Schizophrenia. So very similar, but they don't decompensate enough to probably be hospitalized. Symptoms that are closer to that of schizophrenia than in those of the schizoid personality, such as they show significant peculiarities in thinking, behavior, and appearance. So, what do y'all know about the appearance? We said that it's going to be what? Very what? Could be colorful, eccentric. It's going to be odd. It's going to be different, a little different. What about the clinical picture? They're going to have magical thinking. What is magical thinking? I hear they think they're a witch. They can do things. They got these powers. Illusions. Depersonalization. Examples include a lot of superstitions. Give me some of those superstition examples. Don't split that pole. Let me jump on the other side. Don't what? Black cat crosses the street. You got to back up or whatever. Whatever. Don't step on the back of my foot. Don't sweep my foot. Do what else? Don't open the umbrella in the house. Don't walk under a ladder. I've heard that one. Don't break a mirror. 7 years of bad luck.
Don't wash clothes.
On the
On
New Year's Day.
New Year's
Yes.
Day, yeah.
New Year's Eve and New Year's Day. Can't
Wash
wash the
for
clothes.
dead.
Right. Okay, so telepathy. What does that mean? That they can do what? Read your mind. I know what you're thinking. Yeah, I know what you're thinking. Clairvoyance is superpower. They can do superpower things. And then they have a sixth sense. What does that mean? Huh? I didn't hear it.
What about, like, how people say I can read your aura?
They know things that you don't know. Like, I know what's going to happen. I'm not going to say a word, but it's already been told. It's already been told to me. I'm just going to sit back and watch what's going to fall out. Y'all don't want to listen. Y'all know some of these. You've seen some of these personality traits, haven't you? Sometimes they can be bizarre pattern of speech, strange speech. Logically, they can become lost in their own personal irrelevancies. Under stress, these individuals may decompensate or develop some psychotic symptoms, such as delusional thinking, hallucinations, or bizarre behaviors. But these are usually brief. Predisposing factors, guess what? Common among what? First degree biological relatives of people with what? Schizophrenia that among the general population. It says that they have interpersonal discomforts with interpersonal relationships may provoke other children to avoid relationships with them. It also says that they engage in bullying, which reinforces their withdrawal from others. So this person might, as a child, might engage in bullying. And that just reinforces their way to be alone by themselves and not interacting with others. Schizotypical. Can y'all recognize that individual? Who are you going to nominate, Jada? Pick one. You got to.
Somebody say they'll do it.
W is a 45-year-old male. He lives alone at his home and works as a chocolate maker. He tries to stay home as much as possible because he can get very anxious when going out into town. WW dresses very eccentric and believes that he has many short people that work in his factory. He believes that his chocolate is the best in the world because it gives people magical powers. He does not socialize with others and does not show empathy to personal situations. He is presented to the clinic with symptoms of anxiety and thoughts that someone is trying to take his factory away from him.
Who is that? Willy Wonka. Do y'all remember? Would y'all say he fits the picture?
That's the first person.
Really? That's the first person you thought of. Did y'all come up with anybody else? Let's try this one out. We haven't covered it yet. But Erica, who are you picking?
JR is a 30-year-old male who was arrested for burglary, assault, and attempted murder. He is currently serving 30 years for his crimes. JR is known to throw objects out of his cell door at prison, nurses, other inmates, and officers.
Who is J.R.?
My
Some of your family members?
after my uncle buried, I don't have one.
Any guesses on who J.R. is? Let's look at antisocial personality disorder on 659 and see if J.R. fits this picture. Socially irresponsible, exploitative, and guiltless behavior that reflects a general disregard for the rights of others. They exploit and manipulate others for personal gain and are unconcerned with obeying the law. They have difficulty sustaining consistent employment and developing stable relationships. It's more common in men than in women and found more frequently in those of the lower social and economic classes, especially among highly mobile inhabitants of impoverished urban areas. Does J.R. fit that description? I think so. J.R. So we have to set a lot of limits with J.R. Wouldn't y'all agree? Because J.R. is going to do what? He's going to test the limits, right? So do we have to reinforce things with J.R.? Yes. Even solitary confinement, we got to reinforce and set limits because is he going to obey the rules? No. He has no disregard for the rules or following the rules. He wants to do his own thing. So what nursing interventions would you expect to see? We said set limits. What? Make sure he's not going to harm himself or anyone else. You know, and you're going to have to let J.R. know if you break a rule, there's what? Consequences. You need to assist him in identifying his feelings. You know, what's going on? Why are you doing all of this? Tell me what's bothering you. You want to use those open-ended questions. Well, I got some other examples of people here. Who can tell me who this first one is? What did Ted Bundy do, and what's his personality disorder? So what is he considered as? Serial killer? Yeah, but what else? Which one of those personality disorders? I think when I looked him up, it said antisocial personality disorder. That's what I found. We're just talking in general about these, okay? He was shy and was always a target of bullying, is what the information I found on him. Who is this second one? The Joker. What do y'all know about him? The Joker from Batman. We haven't covered this personality disorder yet, but what do y'all know about him? It's all about, who is it? I hear histrionic, narcissistic, because it's all about what? Him. He craves attention. He demonstrates no empathy for his own victims, right? Last but not least, who is this? And what was he known for doing? Leading a cult and killing people, right? He didn't kill them? He let them. His followers did it. He brainwashed his followers. Who did we say it was? It's Marilyn. Marilyn? Okay. Okay. So it's who? Charles Manson. Charles Manson. All right, let's look at borderline. We haven't covered borderline yet, but it can be found in your book on page starting on 659. What do y'all know about borderline? Anybody? Split personality. What else have you heard about them or do you know about them? Mood swings? Manic? Anybody else? They're like what? Kind of like bipolar? They ruin relationships? What about a light switch? That comes to mind for me. That can be what? On or off, right? Let's look at borderline in your book. A pattern of intense and chaotic relationships with affective instability and fluctuating attitudes toward other people. Your book mentioned that they are very impulsive, are directly and indirectly self-destructive, and they lack a clear sense of identity. They're characterized by job losses, education interruptions, and marriage breakups. And generally, they're estimated to be twice as common in women than in men. The clinical picture and predisposing factors, nursing diagnosis, and interventions for the care of these patients with borderline personality disorders will be covered later in this chapter. So, I got a mnemonic there for you, or acronym. It kind of shows that they have joy and rage, splitting personalities, splitting relationships is a wonderful thing. They become dramatic and sour over time. Important things can either be what? Good or bad. Let's meet BR. Who is going to be BR? So what is her disorder? Her personality disorder? Not histrionic. Borderline. Latoya said it. It's borderline. It's borderline. That is correct. Very good job. So, we want to look at borderline. When you're studying this content, again, you're going to have to do what? Jump back in your book. Read it. I'm sorry, what did you say? Flip back and forth. It's kind of like your OB book. It's not all in one section, okay? One chapter. And again, you always want to read the nursing interventions and the concept map. You got a care plan in your book. Very good job. Borderline. We got another one here. Who's going to take this one? Not everybody at once.
She arrived at his home in minimum clothing and walked around his front door for several hours yelling at him to let her in.
Who is she? Who is AC? She's histrionic for real. Very good. Dominique, y'all said it in Kishana. Page 660. Let's take a look at histrionic. One thing you'll know about them, they're very attention-seeking. They can be colorful, dramatic, and extroverted behavior. They're excitable as well as emotional people. They often engage in seductive, flirtatious behavior to reassure themselves that they're attractive, just to gain approval. They are self-dramatizing, attention-seeking, overly gregarious, and seductive. They use manipulative and exhibitionist behaviors in their demands to be the center of attention. They go to the extreme. What our society tends to foster and admire in its members is to be well-liked, successful, popular, extroverted, attractive, and sociable. What does that tell us? They want all the attention, right? They tend to use their physical appearance as a means to draw attention to themselves. What do y'all think about that? Their all-consuming need for approval and desperate striving to be conspicuous and evoke affection and attract attention at all costs. So they're willing to go to the what? Extreme to get all eyes on me. They're highly distractible and flirty by nature or flighty by nature. They have difficulty paying attention to detail. They can portray themselves as carefree and sophisticated, and on the other hand, they can be naive. They are strongly dependent. Interpersonal interactions with others tend to be provocative and sexually what? Inappropriate. This person with histrionic personality disorder, they fail through life to develop the richness of inner feelings and without the resources from which to draw. They lack the ability to provide another with genuinely sustained affection. Who is that person? Pretty people. Histrionic. Do y'all know any of those personality disorders? Can you identify them if you saw them again? Can you find them? Will you be able to identify them on your test? Yes, you will be, because we're covering it in depth. You're going to read this information again because you're writing them down, and you're going to do what? Shakiki. Study. You're going to make note cards and go in your book and what? Read it again, and what you going to do next? Y'all going to have it memorized when you leave here. You're going to find the care plan. You're going to look at the nursing intervention. You're going to be able to pick this individual out on test, right? Yes, you are. That's the goal. A lot of these behaviors can cause the individual to seek harm or be very attention-seeking. Have y'all noticed some of the ones we've mentioned? They like all attention, right? They like all eyes on them. You have a care plan in your book on 666 and 667. So what am I telling you that you need to know here? Risk for self-manipulation, risk for self-directed and other directed violence. So we got to protect this individual, and safety is going to be what? Priority for these personality disorders, all right? You're going to review your care plan and be familiar with the interventions. It's simple reading, y'all. It's easy reading. Sounds like a lot. You got to understand it. So draw a mental picture in your mind of what each one of these personality disorders look like, okay? Because I assure you, you will what? All right, let's move on to LC. Who is LC? Who's going to take it?
LC is a 45-year-old male admitted voluntarily to the psych facility following a serious altercation with his wife. LC has a master's degree in psychology and works as a teen psychiatrist. He is very intelligent and is always well dressed. He is very pleasant, cheerful, and easy to get along with. He has many friends and everyone enjoys being around him. He recently was found to have been having an affair with his secretary, who was also married. He had wishes for the secretary to leave her husband and move in with him in a home together. After the secretary remained adamant that she was going to confess the affair to her husband and his wife, he became very rageful, throwing items in the office and breaking his chair. The secretary called his wife and explained the situation. His wife came to his office and began threatening to call the police if he did not calm down. He then blamed the affair on the secretary and stated that she manipulated him into the relationship. When the wife insisted that he was lying, he turned over his desk and stormed out of the office.
Who is he? Who is LC?
Jerk.
Say it loud. Narcissist. Narcissist is LC. Let's find him in 660 in your book. Exaggerated sense of self-worth. They lack empathy and they're hypersensitive to the evaluation of others. The clinical picture, they lack humility. They may be overly self-centered and exploit others to fulfill their own desires. They often do not perceive their behavior as inappropriate or objectable because they view themselves as what? Superior beings. They believe they're entitled to what? Special rights and privileges. Who is that? Who gets the VIP pass in here? Although often grounded in grandiose distortions of reality, their moods are optimistic, relaxed, cheerful, and carefree. Their mood can easily change, however, because of fragile self-esteem. In selecting a mate, the narcissist individuals frequently choose a person who will provide them with the praise and positive feedback they require, who will not ask much of their partner in return. That's draining. They'll kind of have to always build this person up and be their cheerleader. Predisposing factors, they may have a parent-child dynamics of either excessive pampering or excessive criticism. So be careful what you're doing to your children. Personality disorders among children whose parents have the disorder. Children may develop into adults with narcissist personality disorder through modeling what? Their parents' behavior. Narcissism may develop from an environment in which the parents attempt to live their lives voraciously through their child. Who's doing that? Research has identified a decreased volume of gray matter in areas of the brain responsible for empathy, emotional regulation, compassion, and cognitive functioning. Can y'all identify the narcissist personality disorder? Meanest person in the room? That's him? Okay. They're the most charming person.
I mean, you know, he sounds mean.
He sounds mean, you think? He got to pull the victim in. So he got to be charming to get him in. But then once he gets the victim, what do the victim have to do for him the entire time? Uplift him. Build him up. Make his head swell, right? Give him all the praise. Right? So we got three categories here we're going to look at, which is avoidant, dependent, and obsessive compulsive. When we think about avoidant, what goes with avoidant? And we haven't covered these yet. We're going to cover them next. When we get to dependent, because we have some dependent personality disorders, what goes with them? Very good. And the last one is obsessive compulsive personalities. Perfectionist. So, as we move forward, let's see, can we identify any? Who can take GI? Did I hear a me from this side of the room?
Yeah, Jimmy did. Jimmy said me.
Jimmy? Go for it, Jimmy.
GI is an 18-year-old female attending a university. She stays in her dorm or library alone when not in class. She does not socialize with other students. She's very shy and embarrassed easily when around a group of people.
Who is GI? Avoidant. We're moving on to cluster C. So look in your book on 661. Avoidant. Cluster C. Avoidant personality disorder is extremely sensitive to rejection and thus may lead to a very socially withdrawn life. Does she want to be around anybody? Extreme shyness and fear of what? Rejection. Don't want to be rejected. Let's look at a clinical picture. What does she look like? Awkward, uncomfortable in social situations. From a distance, she may be perceived as what? Timid, withdrawn, or perhaps what? Cold and strange. Frequent hesitations, fragmentary thought sequences, occasional confusion, and irrelevant discretions. They view others as what? Critical. What else? Betraying, and what else? Humiliating. Because of their fear of being rejected, we may see depression, anxiety, anger on oneself, failing to develop social relationships commonly experienced. Do y'all think y'all could pick out the avoidant personality? Do they want to be around anybody? No, they just want to be to themselves. And you might think that they're what? Very what? Shy, very timid. Any questions on avoidant? And avoidant is your which cluster? We're on cluster C. Very good. Let's look at JV. Who is JV?
JV is a 30-year-old male who is attending school for his second degree. He is always on time to obligations. He keeps his planner with him at all times. He follows all rules of the university and makes very good grades.
But he has a personality disorder. And which one is it?
Normal people that we're discussing now.
We're on cluster C. We got one more under cluster C. Who is he? We got 3 under cluster C. Say it loud, Jada. Obsessive compulsive personality disorder. What does it say about cluster C? He likes the rules, don't want to break the rules. He's very rigid. He's going to plan everything to the T.
Ain't that what y'all asked us?
Making mistakes lead to difficulty with decisions. Recurrent obsessions and compulsions are absent. So in this personality disorder, they don't have what? Those obsessions and thoughts like the person with what? OCD. They're just trying to do what? Follow the rules and stay in the box. Are they going to get outside? Are they going to color outside the line? Probably not. When it looks at the bottom part, when we get a clinical picture, people with obsessive compulsive personality disorder have a type of what kind of personality? Starts with the B. It's in your book. Page 662 on the hard copy book. Look under clinical picture. Bureaucratic. They see themselves as what? Constituous, loyal, dependable, and responsible. Although on the surface these individuals appear to become controlled, and under the exterior lies a great deal of what? Ambivalence, conflict, and what else? Hostility. A great deal is what your book said, Ashley. A great deal of ambivalence, conflict, and hostility. 662 in the hard copy book, column B under clinical picture. 661 on the electronic device. Any questions? Can you pick out this personality cluster C disorder on the exam? Y'all gonna be able to pick it out? Yes, you are, because you're gonna study. The answer is yes. Not no, but yes. Let's move on to our next one. Who can tell me about MA? Right. Who is MA? Dependent. MA needs to do what? Move out and get on his own. MA is very clingy. He's dependent on who? To do what? Everything. Do y'all know any dependent personality disorders? They seek attention in dramatic ways. They have frequent mood swings. No, that's borderline. Let me find it. Dependent. 661 in the book. But go ahead, Jada.
Individuals with dependent personality disorder have noticed a lack of self-confidence that is often apparent in their posture. They are typically passive and acquiescent to the desires of others. They're overly generous and thoughtful and underplay their own attractiveness and achievements. They may appear to others to see the world through rose-colored glasses, but when alone they may feel pessimistic, discouraged, and dejected.
So, pessimistic. What does that mean? Nobody loves me. Everybody hates me. If it's going to happen, it's going to happen to me. The worst thing is going to happen is always me. What is dejected? Sad, depressed, always on the bottom. They are willing to let others make important decisions for them. They're going to let somebody tell them what to do with their money. They don't want to make the decision. Should a dependent relationship end, they're going to what? Be fearful, vulnerable because they lack the confidence in their ability to care for themselves. So if you got staff taking care of this person in a mental health facility, to keep them from getting dependent on Connie, what are y'all going to do with Connie every 2 hours? Rotate her out. Because they're going to get very dependent on what? Miss Connie. And Miss Connie going to be what? Tired at the end of her shift. Because they're very clingy, needy. You got to do everything for them. Sometimes you have to do what with them? Detach. Can they suck the life out of you? Literally. So let's see how good you guys are. Y'all have done a great job. And the answers are already on there. Let's see if you can figure out which one goes with which. Number 1, somebody read it. Who is she? She is avoidant. Would y'all agree? Number 2.
30-year-old male who is attending school for a second degree. He is always on time, obligations, planner with him at all times, follows all rules of the university, and makes very good grades.
Who is he? Obsessive compulsive. Very good. Number 3.
24-year-old male who lives with his parents, who has had opportunities to live in his own home but chooses to stay. He feels he is not good enough to make a living on his own and gets very anxious when thinking about it.
Who is that? Dependent. Very good. Y'all are doing a fantastic job with these. I know you're going to do great on the exam. So this is just, again, a list of the medications. And I gave you all page numbers earlier. So you're going to review your antidepressants. And we covered antidepressants with the mood and affect concept. Remember, we talked about some of the first line antidepressants. Y'all named several of them. You knew them. Do y'all remember that? Knock the dust off the box. Right? We didn't mention antihistamines. What are 2 antihistamines we see used a lot? Benadryl and what else? Vistaril. Do y'all see a lot of Vistaril? Sometimes we use the Vistaril, for example, to help with what? Say it. Anxiety. To get help with anxiety. We know that this can make them unsteady. Should they be operating any heavy machinery with this Vistaril? No, they shouldn't. Benzodiazepines. That's everybody's favorite. Everybody wants a benzo. What are benzo examples? Xanax. What else? Klonopin. One more. Valium. So Valium, Xanax, and Klonopin, and you got to know the generic name, the long name, okay? Everybody's wants some of that. What is the problem with those medications right now? We talked about it with the concept overview. You're building a dependent, they're habit forming, you get addicted to them, and that feeling you initially got when it was prescribed, are you going to get that feeling as you build up that dependence on it? No. So that's going to cause the provider to do what? The patient is going to want what? More of it. They're going to want a higher dose. Can you give it to me 3 times a day instead of 2 times a day? Right? But we know that these medications mixed with opioids can do what? Lead to respiratory depression, depress the respiratory system. So a lot of patients who are on these meds, what are we doing with them? Weaning them off. Do they like it? They're not happy campers. But guess what? It's a slow go. You never take the little old lady who's been on this for 15 years off of this medication overnight. It's going to be a slow go. So you want to give patients to do what? Buy in to the plan. So if we've been giving her 30 every month, what would be a little more ideal next month? Y'all tight. This woman has been on this for 15 years. You're going to go from 30 to 20?
25.
I'm going to be nice, Tony. I got a heart. I'm going to go with 25. Yeah. Do y'all really think she can give up 10 pills in a month? Let's be realistic. Be realistic, Tony. What is this lady gonna be? She gonna be in somebody's ER.
A nervous wreck.
Y'all gonna pick her up. She gonna call y'all. She gonna have some problems, some severe anxiety. But oftentimes, if you can get the client to buy in, we can set realistic goals. We're at 30 this month, Miss Connie. We need to work on tapering them down. Let's try. And she'll say 29. No. Realistic. So about 25, not too fast. Antihypertensive, we mentioned one in a case study, and what was that one? Propranolol, and how would you know if it's working? Heart rate, blood pressure, and decreased anxiety. Very good. Anxiolytics, we mentioned one, which was Buspar. What's another one? Ativan and Librium. Ativan and Librium are some other ones. So those are just ones I want to throw out there and mention to you all. As you read your care plans for anxiety, you will see medications mentioned. We're not looking for specifics, but just for you to have a general working knowledge of just medications in general that's used. How do you know if they're effective? And maybe safety. Any questions on your exemplars for today? Stress and coping. We did 4 objectives. Stress and coping. Any questions?